Hello, everyone, and welcome. Thank you so much for joining us today. My name is Aiden Dowling. My pronouns are he, him, and I am the co-founder and chief advancement officer here at Point of Pride. We are excited to have you with us for this special conversation, which is part of our Transgender Awareness Week programming. So happy Transgender Awareness Week. Hi, Dr. Sherie. How are you?
Hi, I was just figuring out why my camera wasn't coming on, so excuse me, I'm old. So,
No, no worries. Happy you're here. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're really grateful to have everyone here with us as part of this important dialogue. So before we begin, I want to put a disclaimer out that this information is provided for educational and informational purposes only, and it is not intended as medical advice. Please always consult a qualified healthcare provider for personalized medical guidance. I'd also like to take a minute just to introduce those who may not know what Point of Pride is and what we do. So we were founded in 2016, and we are a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our electrolysis support fund, our Thrive Fund, and currently open for applications, please take a note, our annual surgery fund. Our mission is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to services they need, like living authentically and thriving. I'd like to introduce Dr. Sherie, and then I will also be happy to introduce Bram, our co-host. Dr. Sherie, I'm pronouncing your name correctly, am I?
yes, perfectly. Yeah, yeah.
Fabulous. Okay. So Dr. Sherie is committed to reimagining the cosmetic surgery experience. Inspired by her own experiences and the patients she's met, everything she does is directed towards one clear objective: to help you achieve your health and beauty goals. Dr. Sherie understands the power of change and that freedom comes from knowing you can choose to make changes to your body that make you feel more like you. She believes everyone should be able to create an image which makes them feel comfortable or inspired or just seen for who they are. And next up is our host, Bram, pronoun she, her. My apologies. Dr. Cherie's pronouns are also she, her. Bram is a Kansas-based retail manager with a deep passion for fashion, LGBTQAI plus rights, pop culture, politics, and country music. When she's not working, she's dedicated to advocating for her community and expressing her unique style. Bram brings warmth and inclusivity to everything she does, making a positive impact both at work and in her personal life. So thank you, Bram, for hosting this event, and Dr. Sherie for being here to spread your experience and expertise. As a reminder, we do have times for questions at the end of this discussion, so please feel free to ask them in the chat or the Q&A box at any time, and I will make sure that they get handled appropriately. And for right now, I'm going to go off camera. I will be in the chat, and I'm going to hand it over to Bram. And of course, I'll be here if you all need anything.
Thank you.
Hello. Hi, Dr. Sherie. How are you?
Hi, I'm well. How are you?
Good. I'm great. Okay. So before we get started, I'm unaware. Is it orchiectomy? How do I say that surgery?
Yeah, so it is. You're saying it perfectly. It's orchiectomy, but
Okay.
I've also seen there's also a term orchidectomy. It's an
Okay.
older term, but you might see that out there. Also
Awesome.
means the same thing. Yeah.
Okay. So our chat today will explore two gender affirming surgeries: breast augmentation and orchiectomy. Both procedures are crucial components of care for many transgender and non binary individuals seeking alignment between their physical appearance and their gender identity. Breast augmentation involves the surgical placement of implants or fat grafting to create a more feminine chest appearance. The procedure can be vital to trans feminine individuals in reducing dysphoria and enhancing body confidence. Orchiectomy is the surgical removal of one or both testicles. It is often pursued by individuals assigned male at birth who no longer wish to produce testosterone, or those who prefer to stop hormone replacement therapy without the use of blockers. These procedures not only alleviate gender dysphoria, but can also improve mental well-being and provide trans individuals with greater control of their medical journey. Thank you, Dr. Sherie, for being here.
Well, thanks for the invitation.
Yeah, of course. How are you this evening?
I'm probably as well as anyone is, and
right
in the current
climate,
but yeah.
Right. So what inspired you to begin working with transgender and non-binary patients?
You know, I'm old. So for many years, I was a general surgeon, and I was in the Air Force, and I did a lot of general surgeries. But believe it or not, the military was pretty good about letting me just kind of like do whatever I wanted as long as people were happy. So I got a little taste of doing things like loose skin for weight loss, gynecomastia for the cis guys, things like that, right? Then after I got out and I experienced the corporate hospital culture for a while, I really didn't like it and I wanted to do my own thing. I went and did a cosmetic surgery fellowship in Seattle, Washington with Tony Mangabad, and he did some top surgeries and gender affirming surgeries. And I loved it. I loved the community. I just think it's so powerful to be able to change what you see every day. You know, your home, your body is your home that you can't ever leave, you know? And so I think that that's just so important. And definitely I had instances in my own life where I wanted to change something and it meant a lot to me. But anyway, when I moved back to the East Coast to be closer to my family, I wanted to be within a day's drive. I moved to Charlotte, and you know, I at first my practice I moved here in 2013, got the practice all set up and built and all that, and opened early 2015. And at first we offered everything, but I particularly highlighted, you know, some of the gender affirming surgeries that I did, and the business really grew. And as soon as that started to happen, we decided to exclusively focus on that, because there are plenty of people out there offering your standard mommy makeovers and everything else. And I just really liked this niche, and I really liked seeing people just feel more emboldened and feel, you know, so yeah, I've really appreciated the community. And honestly, I think if you have something that you love to do and a place you like to live, you're already in like the 1% of happiness. Like, honestly, I really think that whatever comes, like, I'm very, very grateful for that, for having that opportunity.
Absolutely. No, that's actually really beautiful. I was trying not to cry. That's why I was muted. It was really beautiful. What do the surgeries entail? So could you walk us through the surgeries and what that all involves?
Yeah, sure. And if you want more detail, less detail, just let me know.
give me the bullets, and then if somebody wants more, we can do it. Yeah.
Right. Yeah. So let's start with just breast augmentation. Basically, somebody would have a consult. Most people that we see are not going to require anything extra. I use informed consent. So, you know, unless someone has recent issues that might mean that they need to talk to a therapist, I don't automatically ask for any kind of therapy note or anything for gender affirming surgeries. So with the breast augmentation, you have a consult. If you needed to do anything, we'd let you know. We'd talk you through the options. The primary options that you're going to be thinking about if you're looking at a breast augmentation are the type of implant. And the ones that are available in the US are going to be either saline or silicone. Personally, I prefer silicone just because it's softer. And you're less likely to see any little ripples under the skin. Some people just feel safer with saline, but it is harder because you're basically taking a shell and filling it with a fluid. So it's kind of like a water balloon. So the type of implant, of course, the size, and people do this different ways. But what I like to do is have people come in and spend a few minutes in our exam room just trying on different sizes. We've got a bunch of different shapes and sizes that people can try on. And then, so once you've chosen that, under the muscle or over the muscle is the next kind of thing to think about. And there are pros and cons of each of those. And then how to put them in or where to put them in. Options are basically at the lower chest, like at near the fold of the breast, the underarm, or around the nipple. And I prefer to do the underarm just because it's hidden and you don't have to have a scar on your chest. But those are basically the 4 big things that we decide during a consult with someone. The actual surgery is done under general anesthesia, so you're completely asleep. If we're putting it through the underarm, I'll numb both areas. We'll make a little incision. It's usually a couple of inches long. And we have actually these things, if we're going to go under in a small incision, called Keller funnels. And what it looks like, if you imagine, those little, those soft pipette things that you would use if you're doing cake icing in a fancy thing, it's like that. It's that shape. So it's wide at the top and narrow, and it's like slick plastic inside. You put the implant in and you kind of push it in like that. So it kind of goes in like that and then opens up. Yeah. So that's what I use if I'm going under the arm, that funnel. And if we're going under the muscle, if I'm going that way, which is the most common way that I do breast augmentations, you're never even touching the nipple or the breast tissue. You're going right under the pec muscle right here where it forms the underarm and just putting it in there after you've made a pocket for it to fit into. And then honestly, I love breast augmentations because it's like instant gratification. I can be an impatient person. And so it's nice, like it's
I think
surprise,
you and
like
the
you
rest
see
of
it
the
right
world,
away.
you and the rest of the world might be a little impatient. So yes, you get the
Right.
satisfaction of the surgery
Yeah.
right then.
Right. A couple of little things that I like to do. So when we do liposuction, use tumescent fluid. And what it is lidocaine and epinephrine. The epinephrine kind of constricts the blood vessels and decreases bleeding. The lidocaine helps numb and decreases pain afterwards. I like to put that in the area that the implant's going to go and let it sit for a few minutes. And then the other thing I like to do is to put a small dose of a neurotoxin like Botox or Xeomin in each pec muscle so that afterwards, you don't have as much tension and tightness and pain. You can still do everything. It doesn't paralyze your whole muscle, but it kind of just helps it relax a little bit. Because at first you're going to feel really tight and weird because, something's under your skin and under your muscle. And after that, it's just really a matter of time. For most people, you're going to be smaller at first. Your skin has to stretch to accommodate the new size. Your muscle has to stretch. And so at first they'll look higher up because that bottom skin below the nipple needs to stretch out to allow it to settle, or some people will call it like fluffing or fluffing out. But that's kind of the basic mechanics of it. Is there anything that I missed or that you wanted to ask about?
Not specifically on that. I don't have specifics on that right now, but what
Okay.
about orchiectomy surgery? What are those kinds of ins and outs of that?
Right. So orchiectomy, same kind of thing. If it's gender affirming, I don't require a therapy note.
Okay.
That's the one surgery that I do ask for a therapy recommendation in some cases, and that's for cis men, because believe it or not, we get quite a few of those requests.
Yeah.
And sometimes it's
Did you hear that,
specific.
everyone? Cis men do these surgeries too. I just want
Yes,
that
yes,
noted.
yeah, yeah. And if it's for chronic pain or something like that, I understand. Sometimes people literally do want to decrease the effects of testosterone on things like their libido and things like that. But the reason that I asked this guys to do a therapy note for this is just because occasionally it is because people are influenced by a specific religious practice or specific relationship that they're in. And I don't want people to do something for someone else, and then regret it later if the relationship ends or if they leave that church or whatever. But if it's gender affirming, it's kind of obvious why somebody would want to have it done. So I don't ask for anything there. But the actual surgery itself, there are two ways to do it. You can do it through the groin by making an incision on each side, basically pulling up the whole cord where it exits from inside the abdomen and goes through the canal into the scrotum and taking it that way. I prefer to just do a transscrotal. So I offer two ways. One is with scrotal excision, one is without. So if somebody plans on possibly having vaginoplasty in the future or any kind of thing, you want to leave your skin. And so for that, I just make a little incision, again, about 2 inches long in that little midline of the scrotal skin and remove each thing that way. And I take the cord very high up near where it enters the body. So afterwards, it just retracts back. Now, the skin itself will look less after the surgery, and it'll make tucking easier and things like that because it kind of draws up because there's nothing weighing it down. But it's all there. So if somebody decides to have vaginoplasty later, you can stretch it out, see it, it's all there. If somebody's like, yeah, this is it, I'm not going to go any further, and they want to be just smooth, we'll just do the whole thing. So we'll take the scrotum and the testicles and the cords, and it'll basically be just smooth in that area. Anything that you think of with that you wanted to ask about?
Who or what advice would you give to patients who are seeking either one of these surgeries? Where to begin? What's the first, before they get to you, what's advice that you would have for them?
Honestly, I think most people kind of worry themselves too much. Like they think that they have to do something special to qualify for surgery or something. I think it makes sense if you plan to take hormone replacement therapy and you've just started it, you might want to give it 6 months or a year to get the shape, especially for breast augmentation, the shape that you're going to have and the size that you're going to have, so that if you get an implant or fat grafting, you don't later get more breast tissue and it's like more than you wanted or something like that. But other than that, there's nothing super special that you have to do to prepare. If someone's using nicotine, it's not like a contradiction to surgery. We won't cancel you for smoking or using nicotine. But if you can stop, it definitely helps with healing and decreases complications. And the whole reason behind that, if anybody's curious, nicotine is a really powerful vasoconstrictor. So it decreases your blood flow. So every time you have a cigarette, it decreases your blood flow out to like your fingers and toes and nose and like to the outside of the body for about 15 minutes. And so that's the main reason. It actually doesn't have much to do with the lung part. But yeah, other than that, I would just say, if you think about those options that you have and, kind of get an idea. And then I think honestly, just starting with a consultation is a good idea because then you'll have more information, you'll know about your options, and you can go from there. But there's not a whole lot that people have to do before surgery, honestly.
Awesome. I did not know that. So that is good information to learn. Thank you so much. What is your most enjoyable aspect of performing gender affirming surgeries? I know you said that being able to see people become who they are. What, for you though, what is your most enjoyable aspect of it?
Yeah, I would say seeing people come back and just like, I also do like top surgeries for trans masked people and like seeing their pictures on the beach without a shirt on, or yeah, people after breast augmentation, like sending their bikini pics the next season, or just feeling more comfortable. Like it's really nice, We have a joke sometimes that our surgeries make people taller because the posture is different when people come back.
Of course,
And
they're
yeah,
they're at home in their bodies. So for
right.
patients undergoing HRT, how do breast augmentation or orchiectomy interact with their hormone regimen? Are there any
So
adjustments that need to happen before the surgery, or what's up?
yeah, so for our practice, for either surgery, you don't have to stop your hormones, except we just ask people not to take meds on the day of surgery. So, or the morning of surgery. So you can either take it that night, or if it's like a weekly shot, if it happens to fall on your day of surgery, you can get it the day before, or the day after. Um, with breast augmentation, it really should not affect your actual hormone status. It shouldn't change anything. I noticed that one misconception that's out there, especially amongst some of the people who are more ignorant and against, gender affirming surgeries, but they think that the breast makes hormones. It doesn't. The breast responds to hormones, but it doesn't make any. So anything you do with the breast tissue, it's not messing with your hormones. With orchiectomy, it's pretty instantaneous. So it will stop almost all testosterone production. And the reason I say almost all is because our adrenal glands make a little tiny amount. So there'll always be that little bit. But sometimes it's so small it doesn't even show up on labs. And the things to know about that, what I find is I would say most of my patients have been on blockers before. And so they've already experienced the side effects that we would expect from surgery. But that would include decrease in bone and muscle mass. So just like the rest of us, if somebody has this procedure as they get older, they need to pay attention to just their vitamin D levels, weight bearing exercise. You need to start getting your bone density checked when you're in your 50s and 60s and 70s. Same with muscle mass. You want to do some weight bearing exercise, which we should all be doing, but I'm not very good at doing sometimes. As far as, and this is a common question, is basically about sexual function after orchiectomy. So a lot of people, again, have already experienced the changes if they've been on blockers, because your nerves still work, your blood flow still works. So you can still have penetrative sex if you want to, erections still happen, but your arousal pattern may be different. It may take you more to get aroused. Like you may not get aroused just seeing somebody walking down the street. You may have to actually talk to someone. Just kidding.
That would be great. What a shocker.
Right.
To somebody first.
And if you're somebody who is used to like morning erections or spontaneous erections, that may not happen. But everything will still work if
works.
if that's what you want to do. It can also cause just mood changes, and that's with any big hormone change. You can get temporary depression, temporary fatigue. You can get mood swings. If your T is already very low before you go through the surgery, probably you're not going to change. If not, if you've been off blockers or haven't been on blockers, that's something that it's good to have a support system around you. And in general, I think something that's not talked about very much is with any surgery, like even something you really want, just like with postpartum depression, people can get like post-procedure depression temporarily. And I think it's just your body undergoing a big change, just anesthesia, just physiologic changes. But it's not uncommon for after a big event like a surgery to kind of have a downtime for a little while. And I think part of it may just be just, the build up. Yeah.
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 Is it possible to have both of these surgeries or procedures done at the same time?
Yes. Yeah.
Would you
So
suggest doing them at the same time, or would you suggest doing them different times?
I say what works for somebody's lifestyle, quite honestly. Me personally, if I can do more at the same time and just take one time off work, I would rather. Yeah. But for these surgeries, because they're not super long surgeries, it's safe to do them both at the same time, and you just have to be under anesthesia once. So if you know that you're going to do both, it probably makes sense to do them at the same time. But then, it depends too on the person. Financially, they may have to make arrangements. They may not want to have incisions in multiple places at once. But there's no reason you can't do that if you want to.
Awesome. What advice would you give patients to help them manage their expectations about their surgical outcomes, whether it's breast size or changes after the orchiectomy? What advice would you give them that you've seen through your patients?
You know what? I think that there are so many good groups out there where patients talk to each other. And I would actually really encourage people to talk to each other because,
Community, for sure. Yeah.
and I think just kind of seeing other people go through the process is kind of a good, especially if you've never had surgery before in your life, which some of our patients are younger and they haven't. Um, I actually think peer to peer, like asking about the process is probably the most accurate thing. I had a breast augmentation when I was in medical school. I was super uneven. It meant a lot to me to feel more confident wearing certain things and all that stuff. So I can speak to that. I can't speak to orchiectomy, but I do think most of our patients do really well with it. But I do think, like, as far as managing expectations, orchiectomy is pretty simple. Like, you know exactly what's going to happen. Breast augmentation, I think the main thing for some people is just being patient and letting it take time to fully do what it's going to do. Because, at first it's going to feel weird. It's going to feel like it's high up on your chest. But yeah, so I think just that patience piece, and that's where I think, like, just having other people to check in with and say, hey, what did you look like in 3 months, and things like that, as well as just checking out photos. We have photo galleries of people at different stages and things like that, which we're actually in the middle of trying to start updating right now. But yeah, I think community is really important. For almost anything in life, talking to someone who's already been through what you've been through is really valuable.
Of course, of course. So most patients need multiple letters before surgery, as you mentioned earlier, which can be hard to obtain and is costly. Can you speak more on confirmed consent? Why is that important
Yeah.
to you in your practice?
Because I don't think it's fair. I mean, I just,
Hmm.
from the get, like, it really bothered me to think that, like, if a 90-pound woman wants triple D breasts, no one is making her go talk to a therapist first. And not that there's anything wrong with that. It's just that I just feel like it's not fair. If we say that someone in their right mind and I always ask people, like, have you had time how long have you been thinking about this kind of surgery? Do you know anyone who's had it? Because I do want to feel like people have had some time to think through things, but that's for any surgery. I just don't think it's fair to have um, different qualifications or different requirements based on what. Like I said, with anyone, if they say that, I'm doing this because I'm going through a divorce and want to look better for my spouse, or if they say that, I had a suicide attempt last month and I'm still kind of going through things, then I may want somebody to talk to a therapist. But that's for any surgery. I basically feel like whatever requirements you have should be the same for whatever you're offering. I just don't think it's logical, quite honestly. And I think it grew out of insurance companies requiring certain things.
Mm-hmm.
And I think it's almost more like putting little barriers in the way. And then I think it also comes from kind of this cultural misconception that if somebody has gender dysphoria or body dysphoria, that means that they are crazy or have a problem. And I think that that's where some of this comes from.
Of course. So with everything kind of going on in the United States right now, what do you find most challenging in your work with gender affirming surgeries, and how do you overcome those challenges? You kind of mentioned insurance and all of those barriers that you were talking about. So
yeah, honestly, my staff and I have done a lot of talking about this, in the last couple of weeks. I think part of it is it doesn't make the actual work harder, right? It's more conceptual, and it's more like trying to think through all these scenarios of what will we do if this, or what will we do if that. What we've kind of decided, and what I feel like is, let's say someone wants a breast augmentation, someone wants a flat chest. According to our HIPAA laws, like, you can't ask for someone's medical records to find out why they did something. So quite honestly, we're just taking certain language out of our consults and out of our things. And we're just, instead of saying female to male chest reconstruction or top surgery or something like that, we're just saying elective mastectomies, elective breast augmentation, because there's no law against doing those surgeries. And if they do make it, or try to make it, illegal to have gender affirming surgeries, we're just going to call it something else, quite honestly. Because you can still do those surgeries for people. The challenge would be, basically, one, I think it's always good to go into surgery or anything major when you're calm, when you're at your healthiest, when you're not facing huge psychological or mental or physical challenges. And so I worry about that. I worry about people going into surgery because they're scared it's going to be taken away, or they're in a really fearful or anxious place, because I do think it affects their healing and things like that. And then the other thing, which kind of breaks my heart, is if that were to happen, even if I did the surgery, I can't provide, we can no longer provide our letters saying this person's had gender affirming surgery and should be able to change their name, change their driver's license, change their birth certificate. We wouldn't be able to do that. I don't see it going that far, but then again, I didn't see a lot of things happening that happened. So
I don't think a lot of us did either. Yeah. What do you hope to see in the future of trans healthcare? How do you think access to these surgeries can improve as healthcare systems evolve, as this is evolving, and as we're all learning what we can do? You said you're changing language. You said you're going to give access as you can. So what do you see as the future of trans healthcare?
I think a couple of
What do you
things.
hope for?
First
Not
of
what you
all,
hope for.
yeah. First of all, in general, I just want to say that I see the whole movement of people being open and honest about gender differences and being on the different spectrum of gender and sexuality and things like that. I think it has been good for people like me, like cis women, because I think by challenging those gender norms, it's really it's helped make us question a lot of the stereotypes and restrictions that people have put around the binary of male and female. And so I think by having more and more people who are more diverse on this wide spectrum of human biology and psychology, that it's good for all of us. I really do think so. I personally am trying, in my optimistic self, I truly think things will become more normalized and freer, and people will be able to express themselves as they want. I think as we do more and more surgeries, I'm hoping there'll be more medical research. For instance, I would like to see to really pin down breast cancer risk for trans mass people who've had mastectomies. Nobody's really studied that long term. I would like to know patient satisfaction and nipple sensation with different breast augmentation techniques long term. And if it's different between different patients. I just think a lot more research can be done in the future. And as more surgeries are done, I think that that's going to be a thing. And I do think we're going to get better and better at what we do. I think that just like with everything else in medicine, will become less and less invasive and have more and more options.
Yeah, for sure. Speaking of options, our last question before we go to the Q&A. You mentioned that you offer other gender affirming care. What other surgeries do you offer through your?
Yeah, so we do We do female small chest reconstructions or basically elective mastectomies. And, and we have some people who want a flat chest who aren't even transmasc, and that's fine too. Um, so we do that. I also do body sculpting, which I, again, find really fun because it's kind of instant gratification. But usually I'm using a combination of like liposuction and fat grafting to change the proportions of the body. So some people want to be more, to take away their curves and be more masked, and some people want to really emphasize certain curves and feel more feminine. But, I do think it's cool that in this day and age, I see all kinds of expression. Like I see people who prefer to be more top heavy or more bottom heavy or this, that, or the other. It's not as cookie cutter. It's when I was growing up and like, it's like this one ideal, which I think is really, really fun. But yeah, so basically I don't do any of the bottom surgeries right now besides orchiectomy. And that's only because we all do all outpatient surgeries in our own private surgery center. And some of those procedures, you really need to be in a hospital afterwards, and it takes a little more care.
Absolutely. Dr. Sherie, thank you so much for this amazing chat and all of the information you've given us. Again, everyone, if you have questions, please drop them in the chat right now or drop them into the Q&A section below. We're going to get ready for our Q&A section. I'm going to pass it back over to Aiden for the next minute before we jump into the questions. But thank you so much, Dr. Sherie.
Yeah, thank you. Thanks. It was nice to talk with you.
Nice to talk to you as well. I will follow you on Instagram and all of the socials and all the things you're on. So everyone as well, please follow her socials and all of her things.
Yes. I will drop them in the chat. And don't go far, Bram. You're coming back for Q&A. But thank you, Bram and Dr. Sherie. Before we begin questions, if you feel inspired by today's conversation, we encourage you to make a donation to Point of Pride. I'm dropping that in the chat. Your support allows us to continue providing gender affirming services like HRT, GAFs, breast augmentations, orchiectomies, if I'm pronouncing that correct, Dr. Sherie.
Yeah, absolutely. Yeah.
I love it. And we've worked with Dr. Sherie in the past, which is why she's here. So we love all of those things. So thank you so much. Again, you can just check out the link in the chat or text trans futures to 44321. Every contribution makes a difference. I am going to hand it back over to Bram, and I'll be back in just a moment.
Awesome. Okay. So now onto the questions. As a reminder, you can drop questions into the chat, the Q&A, or use the Zoom raise your hand feature, which I'm not really sure on, so we'll work it as we go, to come up and ask a question directly to Dr. Sherie.
I saw a few questions coming up as we were talking, but I'm going to admit I don't know how to see them now or how to go back.
I'm going to go back to some that I did see. There were a few.
Sorry, Bram, that's my job. I am sending you one. I'm trying to copy and paste it, but it's just doing a million different ones. So I'm going to send you one right now. Give me one second.
They're going to be sent to me, and I will read them for Dr. Sherie.
Here we go.
Okay. Do you use local or general anesthesia for an orchiectomy?
So you can do local, but quite honestly, at this point, I just give everybody heavy sedation, and I don't give it. Air anesthesia provider gives it. Let me take that back.
You're just passing it around like it's candy.
Yeah. But basically, because we're operating 3 days a week, because we have anesthetists that we work with all the time, I find it's just easier for the patient and for us to just let everybody get sedated, and it doesn't really change the price, quite honestly, because if you're doing just local, as you can imagine, there's a lot of nerves in that area, and so it takes a lot longer because you numb a little bit, you let that get numb, and then you have to go further and further, and it's just kind of smoother for the patient and for us to be asleep. Now, air anesthesia providers typically for these procedures, unless somebody has a known like difficult airway or issue, they don't use the endotracheal tube usually. I mean, we have that, We can do it, especially if we're turning a patient to like do back lipo or something. But for these procedures, our anesthesia providers typically use what's called a laryngeal mask airway, or LMA. It just sits at the back of your throat, so you don't get the whole sore throat and all that of the ET tube. So, it's whether you want to call it deep sedation or general anesthesia, basically the person is completely asleep during the procedure. But because it's not a long procedure, the recovery is pretty quick. Typically people are awake and in the wheelchair and going back out with their caregiver about 30 minutes after surgery ends.
Oh, wow. That's awesome. So on an orchiectomy, is a drainage tube needed?
Never use it. And same for breast augmentation. And actually same for our other top surgeries. So very rarely use drains. Only use drains if I'm doing extensive liposuction. So I'm putting in a bunch of numbing fluid. So if I'm doing like a whole body lift where I'm doing the front, the sides, and the back, or somebody has a big area of lipo. But for these surgeries, don't use a drain.
What does the healing process look like for a breast augmentation?
It really depends on the activities you're talking about. So most people are just feeling kind of tight and sore for a few days after. Well, first you're numb, because I do put in a lot of numbing fluid. As that wears off over the first 48, 72 hours, people just feel tight and sore. A lot of people just describe it as the feeling of if you did 100 push-ups the day before and you wake up and you're like, oh, what did I do? There's not a whole lot of restrictions afterwards, except that I tell people not to do like heavy, high impact things like jogging and things like that. Probably for the first 2 to 4 weeks, because it just increases swelling. And I ask people not to wear underwire bras or really restrictive like demi bras or anything like that for the first month, and wear a soft bra, like a sports bra or just something with that wire in it. But other than that, you can go about your regular activities. You can drive as soon as you're not taking any pain meds. So it depends on your pain tolerance. And if you're okay with things like ibuprofen and Tylenol, you can go drive 24 hours after anesthesia. Or if you're only using like the pain meds at night, you just don't want to drive like 4 hours for 4 hours or so after taking like one of the narcotics.
Yes, please don't drive. Please don't take a narcotic and drive. Right. Someone wants to know, do I need to do anything special in preparation for a breast augmentation? Like, how can I better be prepared for it? P.S. Thank you for everything you all do.
Oh, that's so sweet. And thank you guys for trusting us. So no, I mean, the overall answer is no, nothing special. But I do think, and it's just very simple things. I think being in a good sleeping pattern helps you heal faster. Being in a good state of mind, being as healthy as you can be, basically, having good nutrition. But there's nothing like special physically that you have to do to have the surgery, really.
Okay. How long is the recovery for an orchiectomy, and is sex off the table for a while after?
It really, again, depends on what activities you're talking about, but most people are, actually do really well. So you would think that it would be a very painful surgery just because there's a lot of nerves in our genital area. But surprisingly, most people have very little pain. And I think it's just because we're actually cutting through those nerves. And so it just stops basically the feedback from them. For the first day or two, people may experience like a little spasm in the groin area, or they may not. Most people don't, but if you do, it's just because those cords are still trying to move a little bit until they scar down to just like a little bit of scar tissue. But other than that, kind of the same as with the breast augmentation, I would just avoid real high impact things for a couple of weeks. I would avoid immersing in water like a bath or pool for a couple of weeks. But other than that, you can kind of do your normal things. If you have to do a long drive or something, or you're going to be sitting for a while, I tell people to stop every couple hours and walk around, get the blood flow going. And people may want to get one of those little donut pillows like people use for hemorrhoids and things, just so you're not sitting right on it if you do the whole scrotal excision.
With tucking, with that, what do you suggest with that? Do you suggest not tucking during the time of recovery, or?
A good thing, oh, and you asked about sexual activity too. Sorry, let me go back to that too.
Yep.
So the way I do the orchiectomy is like you have absorbable sutures underneath, and then on the very top of the incision, there are some little sutures that just fall off on their own. And that process usually is happening at about by the 2-week mark, if not earlier. I think that's kind of a good measure for when it's okay to start tucking. Once those sutures have fallen off, that means your body has already started healing there and the blood flow is good there. And to be honest, it probably wouldn't like make things completely fall apart or anything to tuck earlier, but it could irritate the incision, make it a little longer to heal. And it can hurt because you have these little hard sutures there, rubbing against you. So I'd say once those sutures fall off in 10 to 14 days, you can start tucking. Sexual activity, again, quite honestly, it just depends on if you're going to have friction right there in that area where the surgery is. So, if you get creative, you can probably be fine.
And there are many ways to be creative in that area.
Right.
So last question that we have gotten for us is it recommended to store sperm before an orchiectomy?
Depends on what you want to do in the future. If you think, hey, I may want BioKids in the future, definitely you want to do that. Definitely. If you're like me and you're like, I like being the auntie and I'm not going to have children, then it's not.
I'm like you. Yes, hello. Love parents, but I'll give your kid back.
Right. But better safe than sorry if you think that might be something you want to do,
Awesome. I believe that is the last question. So I'm going to hand it back over to Aiden. And again, Dr. Sherie, thank you so much for the conversation and answering all the questions that we had. And so much of a pleasure to meet you.
Yeah. And, thank you for taking your Friday night to do this. I appreciate that as well. So.
Me too. I appreciate it from both of you. Thank you both for this awesome event. Thanks everyone who asked questions. I think we had some great questions. And also thank you all for your attendance today. If you'd like to stay connected, I just dropped Dr. Sherie's information in the chat. She has a pretty poppin' Instagram. It's kind of fun to watch. So if you want to go head over there. We'll also have this event on replay on our blog, which will also include Dr. Sherie's information and all the resources mentioned here today, as well as how to get in touch with Bram. I encourage you all to stay connected with Point of Pride by following us on social media at Point of Pride ORG and subscribe to our newsletter to get information about all of our programs and when they open for applications. Also dropped in the chat, our surgery fund is currently accepting applications until November 30th. So if you are interested in any of the procedures we talked about today with Dr. Sherie, you should definitely apply. And if you'd like to support our work, donations can be made by texting Trans Futures to 44321. Before we all leave, I want to remind you of our other programming continuing through the week. So on Sunday, we have 2 events happening. One is all about tucking. It's a tucking workshop. And then our second is all about binding. It's a binding workshop. So if you want to see all of our programming for the week, you can check out our socials or our blog at pointofpride.org. Thank you so much, Hope Sherie. Thank you, Bram. Thank you, Mel. Yes, go ahead.
Just real quick, if somebody didn't get their question answered, or if they watch it later and have a question, please, whether or not you're even planning surgery or have a consult with us or anything, you can shoot it to us. So you can send it through our online inquiry, or you can, just send it to anything associated with my practice, and Kevin and I will get back to you. So if you just have general questions, please, you can send it to us and we will get back to you and answer it.
Awesome. Well, that's very kind of you. Yeah, it looks like someone might have a question, and sounds like you might be getting some DMs or some emails.
Yeah,
So yeah,
absolutely.
awesome. Thank you both so much. Mel, also our interpreter, thank you for attending and helping out those who need it. And yeah, so again, this will be available on replay. Thanks, everyone. I hope you all have a good weekend, and we will continue our programming starting on Sunday. Have a
Thank
great day.
you.
Bye-bye.
Bye.